Today, hope won.
A big development at the state capitol, one that led to standing ovations in both the House and Senate today. Lawmakers approving a key piece of mental health reform legislation. Our investigative team has been tracking this bill for months now, and it is one step closer to becoming law. The Reveal investigator Rebecca Lindstrom live at the Capitol for us to take us through what's next. Rebecca?
The only step left for mental health reform here in Georgia is now the governor's desk. In an amazing bipartisan show of support earlier today, the Senate voted unanimously to pass the Mental Health Parity Act. And then just about an hour ago, the House voted to do the same. But we have been talking about the need for mental health reform for more than a year, exposing the families that have said they felt backed into a corner, that they had no choice but to abandon their child to state custody in order to get them the mental and behavioral health care that they need. Many of those families have been part of this effort to show support for this bill. One of those moms even got a chance just moments after this bill passed to meet with Speaker Ralston and his wife one-on-one to say thank you. And we had a chance to talk with her briefly about just what this bill means to her.
Misdiagnosed, mismanaged medication. We have not given her the evaluations she needed until it almost felt like it was too late. I can only sit here and wonder, had we had the proper evaluations and gotten the right diagnoses that we now have, what would her life look like now? Would that have made a difference? In my heart of hearts, I believe that it would.
And while this will hopefully make a difference for those children, for those families, I want to stress that this reform package is really meant to make a difference for every single person here in Georgia. That's because at the heart of it is mental health parity. That means that in 2008, the federal government mandated that insurers treat a physical condition like a broken arm pretty much the same way, with the same kind of cost and access as it would mental illness like depression. And now, for the first time, lawmakers have put in place what is needed to actually enforce that provision. So once the governor signs this bill, as he has indicated that he will, insurers are going to have to report every year proving that they are actually providing parity in their coverage. The Department of Insurance will set up an officer who will look through those reports, who will look through complaints to make sure that they are being held accountable. And I thought this was interesting. Any state contract, we're talking about Medicaid, other state health insurance plans, they're going to have to commit to spending at least 85 cents of every tax dollar they receive on patient care. All of the sponsors involved in this legislation have stressed, though, that this is just the first step in many years of mental health reform down here at the Capitol.